The challenge at the community level we are facing is the food access and availability. Definitely, I myself did the same thing. When there was announcement about the pandemic, we rushed to the superstores to stock our groceries, particularly food and water. And it becomes difficult for the people who for the people who are not hoarding the food. So the term which is being practiced is food hoarding, that you are going to fill your freezer with all type of food you can have for 1 or 2 months, and this can have an indirect impact on the food supply chain by changing the consumer behavior. And definitely there is the people are forced due to uncertainty and volatility. There are increase in consumer demand for particularly food commodity, and many of us have observed the lack of or the availability of the food items in the store. There was a problem around the globe. And also considering those countries who mainly depend upon the importing food items, it was difficult for them due to the closure of the borders to import food items from different countries. So people hoard more than they need and pose devastating consequences on those people particularly who are at risk. This resulted in extreme shortage in markets and also ultimately leading to the rapidly rising prices. So it was a crucial because there were rumors, that social media nowadays it plays an important role, and different type of news they spread around, and there was a panic buy which resulted in these type of conditions. And for community, if we can talk about the older and adult patients, adult people, they are considered as most vulnerable due to nutrition imbalance. And one of the study by WHO have showed that adults having 60 years or plus age and patients which are having pre-existing medical conditions, this COVID-19 was even more severe for them, and we have witnessed a lot of deaths in Europe, particularly Italy and France, which have Italy is considered as the country having most percentage of the elderly people. So there are a number of deaths in Italy, which when the COVID-19 started in March, April, and May. We have witnessed number of deaths of elderly people, and same has happened in France, and likewise all other countries who are severely affected. There are a number of deaths of elderly people who are facing pre-existing condition. Then the recommendations to stay home by the government and social distancing also targeted these specific group of vulnerable people. And due to malnutrition or the limited access to the food, they were susceptible to malnutrition also. Conditions are some little bit different as we compare Pakistan or the eastern countries, particularly South Asia, with the western countries. The elderly people now, they are independent, more independent than as we compare with our combined family system in Pakistan. Normally the elder people are taken care of by their family members, but here the situation is different. So it was difficult for elderly people, those to maintain, even to go for purchasing their food items. Access was limited for them. So it was there were different organizations who extended their assistance in food access and availability, but situation was not easy for them.